we are in the middle of somewhere in the middle of what I would call a moderate wave of COVID. Quite similar to last year. The amount of activity is about the same. The timing, September into October, is around the same. So certainly we have some COVID around, but fortunately, because people follow preventive measures, including the ongoing benefits of COVID immunization, that still persists from last year or the springtime in people, our levels of severe disease, which we judge by hospitalizations and deaths, are quite low, which is good news. We track things weekly, and so we are starting to see a few cases of influenza and RSV. So those viruses are starting to emerge in Nova Scotia. Again, not unexpected. Typically, it's December into January and February where we see the major surges in those viruses. And of course, there's lots and lots of other respiratory viruses around. We see people with coughs and colds and things. Often that increases in September when kids come back into school and adults come back into university and things. And so we've seen that as well. And so that's all normal. So what can we do about this? There's lots we can do around prevention. So a lot of things we can do will prevent the spread of all respiratory viruses, starting off with, if you're sick, if you have acute cold and flu symptoms, headache, fever, sore throat, coughing, those kind of things, if at all possible, stay home until those acute symptoms have resolved. If it's not possible, then it's really important when you go out and around other people that you wear a surgical mask, and certainly be very careful about not exposing people that are at increased risk of severe disease if they have underlying medical conditions, or they're very young, or they're very old. As we start to get into the respiratory virus season with flu and RSV, we start to move back indoors. So I want to plant the seed for people that as we move back indoors, we need to start thinking about, when we're in crowded indoor spaces, socializing or public events, or et cetera, masking will become a very good idea to help prevent any exposures. And even if it's time to think about our social events, especially if you're going to be visiting somebody who's at high risk. So let's say it's a Friday night. I'm supposed to go to a big party. I'm supposed to also visit my grandmother in the long-term care facility on the Sunday. I think you got to really think carefully about how much exposure you put yourself at risk of in the day or two before going to visit your grandmother. So you may not want to go to that party, or at the very least wear a mask to prevent you being exposed. And if you don't want to be exposed, then you need to wear an KN95 mask. If you're trying to prevent exposure to others, then wearing a surgical mask works. So all those things that we learned during the pandemic apply, and including hand washing as well. On top of that, we have vaccines against three of the viruses. We certainly have COVID vaccine, and we have that available now. I'll speak to dates in a minute. One thing was different about the COVID this year. There is no brand preference, so you won't get to have a choice between which type of mRNA vaccine. We have certain types, and they're all safe and effective, and they're all equivalent, so it makes no difference which of the mRNA vaccines you get. We have influenza vaccine. We have the standard. If you're 65, 64 or younger, then we have the standard influenza vaccine. If you're 65 and above, your immune system needs a little extra boost, so we have the enhanced influenza vaccine. And we now have RSV vaccine for people who are 60 and above if they are in a long-term care facility, or they're in a hospital waiting placement in a long-term care facility. We will be providing those vaccines publicly funded to those small group. Lots of community living seniors are still, asking about RSV vaccine, and that can be available for private purchase if you're a community living senior. Good news today is that as of today, we now have both booking is available for both influenza and COVID vaccines. The first appointments for actually getting vaccine for influenza are October 12th, and the appointments will actually open up for COVID vaccine on October the 18th. So, but you can go on as of today. You can actually go on the website. Just search vaccinations for Nova Scotia. There's the 1-833-797-7772 phone number. Your Health Your Health NS app. You can make a booking there. If you want to get vaccinated through your primary care provider, you need to contact your primary care provider and make appointments through there. But there's lots of ways you can now get your appointments made and get in the line. I would encourage people, because there's only a few days between when flu is appointments and COVID appointments, I would encourage people to look at co-administrating, get both vaccines at the same time. And also a reminder, if you're over 65 and over and you have not had a pneumococcal vaccine, then talk to your vaccine provider about getting that vaccine as well. We're making a major shift in our testing approach. During the pandemic, when what we had around was COVID and not much of anything else, and it was important for people to know whether they had COVID or not. But we're shifting that. We're no longer in a pandemic phase. COVID is part of our normal environment, along with other respiratory viruses. And in medicine, you really should only do a test when that test is going to change how you manage or treat a disorder. For most people now, it doesn't make a difference knowing which virus you're going to have. We're asking you, if you're sick, follow all the preventive steps. Knowing which virus you have will make no difference in what you do. And quite frankly, the rapid tests we only have for COVID, we don't have for anything else. Even if you're negative for COVID, if you're sick, you have some other symptoms, some other virus that you could still be spreading around. So testing negative for COVID can actually give you a false sense of reassurance. Where we need to focus our testing capacity and our testing, within the health system, is for that small number of people who have underlying health conditions. Dr. McNeil will speak more to that, where if we knowing which virus they have, we can then direct them to starting early treatment with an antiviral, whether it's COVID or influenza. So I recognize that is a big shift, but we need people to understand that most people, testing is no longer necessary. It doesn't make a difference in what you need to do to keep yourself healthy and recover, as well as preventing spread to other people. Those who need testing are those where it may make a difference in terms of antivirals. And there'll be lots of communication going out to community groups as of today around access to rapid tests and more information on locations coming. But we really ask the public that if you're not in one of the groups that actually needs a rapid test to know if you have COVID or not, please do not take rapid tests out in the community. Leave them for those who need them.